Doctor, I'm worried I might have HIV.
John's voice trembled slightly, barely a whisper in the sterile quiet of the doctor's office. He nervously adjusted his glasses, avoiding Dr. Jones's gaze.
I've been feeling so tired lately and I've lost weight without even trying.
Dr. Jones, a picture of calm reassurance, leaned forward, her expression gentle.
Tell me more about these feelings, John. When did you first start noticing these symptoms?
John hesitated, then sighed, the weight of his worry palpable.
A few weeks ago, maybe a month, I just feel constantly drained no matter how much sleep I get, and my appetite...
He trailed off, shaking his head.
These feelings are understandable, John. Let's talk about HIV and address your concerns.
Dr. Jones pulled out a pamphlet, colorful illustrations depicting the human body and a microscopic virus. He handed it to John, who took it with a mix of curiosity and apprehension.
HIV stands for Human Immunodeficiency Virus. It's a virus that specifically targets the immune system, which is the body's defense against infections and diseases. It attacks the body's immune system, making it harder to fight off infections and certain diseases. Over time, if left untreated, HIV can lead to AIDS, which is a more severe stage of the infection.
John looked at the pamphlet, his brow furrowed. The information was overwhelming, but he knew it was important to understand.
I've heard of it, of course, but I don't really know how it spreads. Can you explain it to me in more detail?
HIV is transmitted through certain bodily fluids. These fluids include blood, semen, vaginal fluids, and breast milk. These include blood, semen, vaginal fluids, and breast milk. It's crucial to understand that the virus needs to enter the bloodstream to cause an infection. It's important to remember that HIV is not spread through casual contact like hugging, sharing food, or using the same bathroom. Everyday interactions do not pose a risk, or using the same bathroom. You can't get HIV from touching, kissing, or being around someone who has the virus.
John nodded slowly, absorbing the information. He realized there were many misconceptions about how HIV is transmitted.
So you can't get it from just being around someone? That's a relief to know.
That's right, John. HIV transmission requires direct contact with infected bodily fluids. It's not something you can catch through the air or by touching surfaces. HIV transmission requires direct contact with infected bodily fluids, most commonly through unprotected sex or sharing needles. It's also possible through blood transfusions, though this is rare due to rigorous screening processes, most commonly through unprotected sex or sharing needles. It's important to take precautions and understand the ways to protect yourself and others from the virus.